After we've completed our range of motion and our manual muscle testing, the next step would be our special tests. So there are a couple of them that I wanted to review with you using the videos. So the first one is going to be our cervical compression. I like to have the patient in a chair just because I'm a little bit shorter, and sometimes if they're sitting on the table, I can't quite reach them easily. So when we're providing an axial compression, we're going to interlace our fingers. I'm going to stand behind the patient and I'm just providing a downward force straight through the spine. I usually do about 2 or 3 compressions. For the cervical compression test, it would be positive if the patient reports any radiating or paresthesia down into one or both sides. The next progression from this is going to be the Sperling test. So same thing, I'm still providing a downward axial load. However, now the patient is going to be slightly laterally cervical flex, going to lateral cervical flexion. And some people actually have them in slight extension because that's just further closing the facet joints. I'm going to again just provide a downward force. 2, 3. Any symptoms? Okay. Now I'm going to just do the same thing but on the opposite side. So again, remember lateral cervical flexion and then slight extension. If you just do lateral cervical flexion, that is technically okay, but if you wanted to further compress the facet joints, you can go into extension. Next, we have the Jackson's test. So the patient is going to go into cervical rotation. So I'd ask them to look over their left or their right shoulder. Good. And again, I'm just providing that downward axial load. 3. Good. And then any symptoms?
No.
Okay. I want you to look the other way. And I'm just going to push down again. Good. So remember, just like the cervical compression test, for Sperling and Jackson, if there's any radiating pain down into the arm, sharpshooting pain, anything like that, that would indicate a positive test. Next, we have the distraction test. So I'm going to have the patient lay supine on the table, so lay on your back. Other way. So for the distraction test, you would do this for someone who may be experiencing some of this paresthesia that we talked about. So what I'm going to do is I'm going to interlace my hands and I'm just going to gently pull the occiput straight towards me. So I'm not going to lift him up into flexion, he's just going straight towards my belly button essentially. So I'm just interlacing my hands. I have my thumbs on the mastoid process, and then I'm just distracting. So I'm pulling apart part of the cervical spine. If he has a decrease in symptoms or the symptoms are alleviated, then that would be a positive test for potentially spinal nerve root compression. Okay?
Yep.
You can hold this for about 10 seconds or so. Some people will often use this as a treatment as well. Next we have shoulder abduction test, so I want you to stand up. The patient is going to actively go into shoulder abduction and put their hand on top of their head. Good. Any symptoms with that?
No.
Okay, so that may also alleviate some of their symptoms because it's opening those facet joints rather than compressing them. And then lastly is the brachial plexus test. So I'm going to have the patient sit on this chair. And I'm going to passively provide an overpressure. So I'm stretching this side, but I'm also compressing this side here. Do you have any symptoms with that?
No.
So any symptoms would indicate, or would potentially be, again, that radiating pain down into their arm, even in their upper extremity as well. They could have a positive sign on the traction portion of this test, so when I'm applying this overstretch, or they can have a positive sign on this compression, this compressed side as well. So either one would indicate a positive test.